So first and foremost, I'm a chiropractor by trade. I'm also a clinic director for a gym and a clinic in Parkdale here in Toronto, known as Strong. So we've got a small personal training studio on the main level, and then we have a lovely loft where we do some of our clinical work. So myself as a chiropractor, and then our physiotherapist Andrew, who you will meet a little later on. So this is one of my favorite quotes from a scholar, REM, and that is, everybody hurts sometime. Now, I can't see all of you, but if I were to ask who has ever experienced pain, everyone would have their hands right up. Whether it is emotional pain or whether it's physical pain, it's something that we all experience, and some of us might experience it on a daily basis. So one of the most important points is pain is a normal experience. However, there's often all kinds of uncomfortable and unwanted things that kind of come along with being in pain. And we often might describe it as such as well, right? So it might be unwanted or unpleasant. We talk about something hurting. It changes what we do. It changes how we move. It's going to affect us psychologically. It's going to affect our sleep. It can make us anxious. So despite pain being incredibly common, despite it being a very normal thing, there's often some uncomfortable, unwanted things that go along with that as well. So exactly what is an injury? Well, an injury is going to be physical trauma resulting in damage to the body caused by some sort of external force. A really easy example is you're playing soccer by chance. You're running in towards the goal. Someone comes in, slide tackles you, hits you in the ankle. You have an ankle injury, right? So at that moment, your ankle wasn't able to handle the force of a 200-pound defender coming in and taking yourself out. So that has created some physical trauma to our body. Pain, on the other hand, is a different entity. So pain is an aversive sensory or an emotional experience. And it's typically caused by that resembling actual or potential tissue injury. So a couple of points here in this definition, as opposed to the definition of injury that I'd like to highlight. Number one is pain is an experience. It's not some mythical thing. It's something that we experience, and sometimes it can be all encompassing in our day-to-day lives. Another very important point is pain can occur in the absence of tissue damage. So we don't actually have to have an injury in order to experience pain. And pain is both sensory and emotional. It's something that we feel, but it's also something that we feel. It's something that can create an emotional response. And as we'll learn a little bit later as well, our emotions can actually magnify or have an impact on our pain response as well. So pain is also good, despite all these uncomfortable, unpleasant things that come along with being in pain. It's actually an evolved process that's for our protection. So over tens and hundreds of thousands of years, our bodies have developed this pain response in order to protect ourselves, right? So first and foremost, it's going to create alarm. If I go and I just took my pot of coffee off of my stove and I go and I touch that hot stove, there's going to be a signal, that's going to go to my brain that says, hey, you know what? Something's not right here. It then mobilizes our body and prepares us for an action, right? So if that's hot, I pull my hand away. And that's actually something that doesn't even need to go up to my brain. My body has processes, and it's almost like a reflex. If it's hot, I immediately withdraw. And it also motivates behavior. So next time I take my pot of coffee off the stove, I'm going to think twice about immediately going in there and touching it. So it's going to motivate, and it's going to change behavior in the short term as well as in the long term as well too. So in a way, it's almost like we become conditioned to avoid things that might be painful. As we said before, it's a sensory experience, and it involves multiple domains. So actual biological things like, say, joint pathology or I broke my arm. Your genetics has a role in this as well too. And also nociception. Nociception is just a fancy term of saying like these threat signals. So our body just doesn't actually have nerve fibers that specifically are for pain, but what it does have is things that kind of raise our threat alarm. There's also behavioral things. So pain can be influenced by or affect our sleep, our diet, exercise, and substance abuse. And there's also a lot of psychosocial factors as well. How good is your social support? What do you do for work? How educated are you? Your mood and your emotion, your income and stress levels. All these things combined help to create our own individual pain experience. And my pain experience might be very different than your pain experience. So I think that's a very important distinction to highlight. So pain cannot be reduced to a biological entity exacerbated by psychological circumstances. This is a little bit wordy, but I think this is a very important thing. If we've experienced pain before, and particularly have experienced pain for a long period of time, inevitably there's someone that says, well, you know what, it's all in your head. That's not the case. And it doesn't feel good when someone tells you that. So it's not just like, well, you know, I hurt my elbow, but I stress and I worry, and that's why my elbow has hurt for 6 to 8 months. Well, that is a gross simplification of the process. It's also wrong. So pain does not equal injury. And I think this is a very important distinction to make as well too. So pain can happen in the absence of injury, and injury can also happen in the absence of pain. And also the amount of pain that we feel and the magnitude of the pain that we feel is also can be disproportional to the type of tissue damage as well. So pain we can experience pain anywhere from the worst tissue damage ever, I've severed a limb, all the way to no tissue damage or no injury as well. Recall from our definitions previously, injury is actual tissue damage, so the capacity of the tissue is exceeded. We're going to expand on those terms in a minute. Versus pain, which is a sensory and emotional experience. So similar and related, yes, but two very different things. So what is this capacity and demand? So as we will see, these two points here, these two definitions are actually going to guide your whole experience from overcoming some sort of injury and also overcoming the whole pain experience. So, capacity is the physical, mental, or emotional abilities that an individual possesses for a specific task. For example, we'll use running. I was a runner once upon a time, not so much now. But once upon a time, I could run for a pretty long time, right? So how far my body can run before it breaks down, before I collapse due to exhaustion, that is a great example of capacity, right? So it's kind of like, how big is your battery? Versus demand is the physical, mental, and emotional qualities required for a specific task. So if I can run for 9 hours before I collapse, chances are I can run a 5K fun run without any sort of issue, right? So in that example, my capacity far exceeds what the demand is of a specific task. The demands that we put on our body are also specific, but they're also very general as well too, right? So things like work stressors, lifestyle stressors, going through a breakup, getting a new job, hypothetical situation, a global pandemic that forces us all inside and we can't go out and see people that we care about, and we can't go and work out in the gym. All these things are stressors that contribute to the demand. The demands that are on our body. So there's a great analogy of a bucket. So your bucket is essentially what your capacity is, right? So it's a finite size. And then everything that causes you stress, either physical, mental, emotional, or chemical stress, is going to go into that bucket. So if my bucket is only so small, but all these things that are going into the bucket cause it to overflow, all of a sudden the demands on my body exceed what my capacity is, and that's when we can get injured, right? So I say, well, why is this all important? So if you recall from a couple of slides earlier, injury happens when our demand exceeds our capacity. So managing injuries from a very simplified standpoint is we can do it in either one of two ways. We either increase capacity or we decrease demand. And most of the times we do both. So how do we build capacity? So when I say build capacity, I mean, how do we make your bucket bigger? So that's like building strength, improving your endurance, getting you more mobility, getting you more stability. Here is an image from an endocrinologist by the name of Hans Selye, who actually studied at McGill. So there's a nice little Canadian reference here for us. Specifically, he looked at how stress actually affects our immune system, but this is actually true for across like most types of stress. So we can just pretend that the slide here is actually representative of, let's say, a workout with Mel. So initially, there's this alarm phase, and that's when we kind of go and we work out. After your workout, there's actually a little bit of a compensation phase where our capacity drops down, right? Chances are, after a really good workout, your ability to go and complete another really good workout right after that, it has been lowered, right? So there's a short-term reduction in our capacity, but then over enough time, your body is able to recover, your body is able to adapt, and then that kind of creates some of this resistance. So after enough time has passed, when we're exposed to a stimulus or a stress, in our example here, training, our capacity is raised. So between phase 1 and phase 3, essentially what we've done is we've given ourselves a bigger bucket. And then the decompensation phase is if we are continuously exposed and don't give ourselves enough recovery, we actually see some detraining, and again, some injury or some pain might occur in phase 4 there. So some other ways that we can reduce the demand is train smart, which you're already doing, working with Mel. Prioritizing technique in the gym. So making sure that your form is ideal are going to help to decrease the overall demand on our body. Proper programming and periodization, that you have a well-structured plan that you're following. Prioritizing recovery, like I said in the previous slide, you're making sure that enough time has passed for your body to actually recover and increase your capacity. Reducing load and some of the other stresses on our body. Now, we can also reduce demand when we're working from home. So things like workplace ergonomics, making sure that our monitor is in front of our head. If we have multiple monitors, the monitor that we're working off of most often is directly in front of us, so we're not having to turn our neck to the side. Sitting and standing are both viable options throughout the course of the day. Ideally, you can alternate between one and the other. Sometimes I like to tell people to basically divide their day or tasks in their day based on things that they can do while they're doing them. Well, if you can take a phone call, well, maybe you can pace back and forth down the hallway, or you can pace in the room, you can walk a little bit, right? Some tasks you might be able to do standing, some tasks you might have to do sitting. But by switching between standing and sitting throughout the course of the day, essentially what you're doing is you're spreading stress and load and demand on your body through all types of different tasks. Another really effective strategy is this concept of micro breaks. So every 20 to 30 minutes, if you do have to stay sitting, get up and give yourself a movement break for anywhere from 30 seconds to 2 minutes. That might be a long stretch. That might be performing a rehab exercise, something like that. So it can cause minimal disruption to your day, but it can also break things up so that you don't feel physically drained and exhausted come the end of the day. So some other strategies that you can employ. So focusing and prioritizing your sleep. So sleep is going to affect pain sensitivity as well as pain ratings, and also general anxiety. So if you aren't getting good, adequate sleep, that can significantly affect your pain levels. It can also affect how quickly you recover from an injury. Stress interrupts something called the HPA axis. We don't need to know about that. It's not going to be a test, but it's going to have an effect on your immune system. It's going to have an effect on your endocrine system and your nervous system. So as well as like decreasing stress and increasing sleep helps to affect the demand that we're putting on our bodies. And lastly, nutrition, which is a super important piece. So limiting intakes of like sugar, salt, alcohol, other pro-inflammatory foods. Myself, if I eat a ton of wheat, which I love, it adds more demand onto my body. So some self-care things that you can do to help to prevent injuries. Number one is know your limits. If you're new to training, this can be challenging. So again, having someone like Mel to help navigate this course for you, and help to push you when you need to be pushed, but also kind of encourage you to pull back on the reins a little bit is super important. Having an effective warm up and cool down, as well as touching on some of those pieces that we chatted earlier, right? Like prioritizing sleep, checking in and taking a look at your nutrition, reducing stress, and also continuing to train and move. It's very common to try to avoid or cut out exercise when you're dealing with an injury, and that may not be the best thing for you depending on what you're dealing with. And then another important piece is to get help. So training through versus training around an injury. And this is a question that we get asked a lot. If I'm injured, should I stop training? Should I continue to train? So this answer, I think, kind of requires a little bit of nuance. So first and foremost, training is not always comfortable. Everyone knows that, who's ever gone and trained. Some people like that discomfort, some people hate it, and some people train because they know that it's good for them. But understanding what might hurt and actually be okay versus what might actually cause you some harm when you are recovering from an injury are very important concepts. So again, having someone to help kind of navigate that with you, again, like Mel, is a super valuable piece. So generally speaking, exercise shouldn't cause pain, most of the time. And I'm not talking about you did a really strong leg workout yesterday and now your quads are sore. But exercise shouldn't induce some of that harm type of pain that you might experience. I say most of the time because in certain chronic pain conditions and in certain like tendinopathy type injuries, having a little bit of pain doing the exercise to help with those things is sometimes tolerable to a certain degree. Minimize training gaps. So as close as you can, the exercise that you're doing when you're healthy or not in pain should look like the exercises that you do when you're in pain as well. So ideally, the programs look very similar, only making modifications when they really need to be. I have here a marathoner with an elbow pain. I was working with a coach, and she was studying for an exam. And one of the requirements of the exam was she had to write a strength and conditioning program for a marathoner that had some elbow pain on the inside. And this kind of threw her for a loop. And she's like, "Hey, I don't know how to train a marathoner with elbow pain." And I said, "Well, you know how to train a marathoner?" And she's like, "Yes." And I was like, well, this type of elbow pain might get aggravated by a lot of gripping or doing things like this, right? So as soon as I was able to communicate that to her, all of a sudden she's like, okay, yeah, wait a minute. Now I know how to train a marathoner with an elbow pain, right? Because the program looks very similar to what it would in the first place. It's just minimizing those types of gripping motions. So having an active care plan as part of your recovery and as part of your injury management is super important. So generally speaking, I like to divide exercises in a rehab plan in one of two categories: analgesic exercises, so exercises that make you feel good in the short term, and then anabolic exercises. And those are ones that actually help to build your capacity over time. We usually run into problems in rehab plans when we just have one or the other types of those exercises, right? We want to be making you feel good in the short term, but also helping to build that capacity and get you back to doing the things that you want to do. It's also very important to have a flare-up plan. Some injuries, it's inevitable that you're going to have bad days with it in the recovery process. So knowing what you can do for your body from a movement standpoint is very important, right? So when things get really bad, what are some things that you can do to help bring those pain levels down? It's kind of like a movement aspirin. There's some silly sayings like motion is lotion, which I always cringe, but also smile at every time I use it. It's, these things that are often used by therapists that actually go a long way. So having some things that you can do in your toolbox where you can kind of self-manage is super important. It's also super empowering. And can make you feel all of a sudden like you have this pain that's debilitating and taking and controlling your life, versus feeling like you're having a little bit of control over your pain symptoms. So when to seek help? This is a very important question as well. Most often people ask me, when do I seek help, and when do I, or who do I go see when I need help? So, if pain is preventing you from doing the things that you want to do, that's usually when you should seek help with a professional. Also, if it's intense or sudden onset, if it's worse at night, if it's gotten worse over time. So usually injuries and pain kind of start to get better as time passes. If it's getting worse, that might be a good time for a professional to take a look at it. If it's unrelenting, you're not having any highs or lows, it's just constantly there, doesn't really change. If it's chronic, and also if all other interventions have failed, you tried stretching, you tried taking some time off, you tried continuing to train through it, you've tried all these different things, it's still not getting better, that's a good time to seek some help as well. So who should I see? There's so many different people out there. You can, especially if you live in the downtown core, you can probably pass 20, 30 people that might be able to help you out within a 2-block radius, right? So do I go see my GP, like my doctor? Do you see myself, like a chiro? Do you see Andrew, or a physiotherapist, athletic therapist, osteopath, naturopath, a kinesiologist? So many different professions, and each of them have relatively similar scopes of practice with like a little bit of different, right? So asking what job needs to be done is an important question, right? So do you actually need something to be diagnosed? Do you need some manual therapy, someone to get in there and actually really do some aggressive hands-on work? Do you just need some exercise intervention? Sometimes you may be looking for acupuncture or cupping or something like that. And sometimes you may need a referral for imaging. So you might need an MRI, you might need an X-ray or an ultrasound. Some of these practitioners can provide all of those things. Some of them can, only a few can actually send for imaging or diagnose. So knowing what needs to be done can sometimes kind of help guide you on who you need to go and see. But the reality is there's a ton of overlap in terms of what all these people do. So at the end of the day, it kind of doesn't matter who you see, because good therapy is going to be good therapy. If they're a good therapist, they're going to be able to get you better. So rather than no, this is a job for physio, or this is a job for chiro or my kinesiologist, I think finding someone that you trust and can build a relationship with is the most important piece. And the reason for that is you're going to have some uncomfortable conversations. I often say your therapist and your accountant are the two people that you should probably not be afraid to bring anything up and have a conversation about. And also sometimes you're going to be working in uncomfortable areas. So that level of trust and that level of rapport needs to be there as well. Sometimes I treat jaws or TMJ pain. Occasionally, I'll actually do some intraoral work where, I'll glove up and I'll put my hands inside someone's mouth. That can be uncomfortable. So having a level of trust and level of comfort with the practitioner that you're are working with is important, because they may be doing on some of those types of procedures. So in summary, pain and injury are normal. Having pain or working through an injury, it's not the most pleasant thing in the world, but at the same time, it's a normal thing. I always say, regardless of what type of injury you're dealing with, you're not the first person in the world to experience it. Your experience is unique, and I think that's important. But there are no new injuries. There are no new types of pain that are coming out in the world. So it's a normal process, and it's also not the end of the world as well. Pain and injury are poorly correlated. A paper cut with a little lemon juice on it is one of the most painful things in the entire world. Well, at the same time, some cancer, for example, often might not show any sort of pain until much later until it's much further progressed, right? So the type of tissue damage or what's going on is poorly correlated to pain and how you feel. An injury is going to be managed by building your capacity, but also reducing your demands. And we build capacity through training, and we reduce our demands through reducing some physical, psychological, emotional stressors, and some chemical stressors in our lives. Get lots of sleep and eat well. Keep moving. So continue to move, continue to train, even if you're working through an injury, and seek help early. And to that point as well, is like find a practitioner that you trust and that you can develop a relationship with. So that kind of brings us to the end of our presentation. Like I said at the beginning, we have myself and we have Andrew, who is our physiotherapist. We do a lot of the same things. I provide acupuncture. Andrew doesn't do that just yet. I prefer cats. Andrew prefers dogs. Those are the main differences between the two of us. But there's a lot of overlap even between what it is that we do. To my point earlier, that oftentimes it doesn't matter the title of the individual that you are seeking, and it's more so do they have the skill set to get you better, and do you like them? Do you want to be spending some time with them, and you want to be having long conversations with them?